Thank you, Ryan. See, I told y'all there was some good stuff we're going to talk about. Now we're going to introduce the big boss, the president of Our Lady of the Lake, Mr. Chuck Spicer.
Thank you. Always dangerous to hand me a microphone. So, thanks for allowing me to be here today. Ryan does a great job. So, one of the things that attracted me to the lake was when I came here and visited was the talent of the team and the people I get to work with. And Ryan's a great example of that, as is one of my bosses, Todd, who's just returned from Sicily and Italy. So, and again, we've got all kinds of good talent around, so we're happy to have the people I get to work with. Our mission statement says, for each other and for the communities we serve. And it says, we're a spiritual presence for each other and the communities we serve, and that's really important because it's the team that does it for us. Long journey for me to Baton Rouge in Louisiana. I am originally from Abilene, Texas. Hold your hand up if you know where that is. It's right next to nowhere, but also just left of heaven. So I grew up in Texas, thought I would never leave, went to school in Texas, went to lifelong Texas fan. Don't flash the horns down to me. That's an OU thing to do. But I actually found myself at Baylor University. I went there for my high school girlfriend at the last minute, but I stayed a Texas fan, and she decided to date another guy. So kind of had an interesting journey into healthcare, thought about law school, thought about politics, and then had an experience at a hospital in Abilene, Hendrick Medical Center, in 1991, where I got to experience the Children's Miracle Network telethon. You guys know what that is, right? It was the early days of that, and as a young college kid trying to figure out what he wanted to do, for the first time in my life, having been around doctors and nurses, and having been in hospitals, I never kind of put the whole thing together. It's really not about what happens in the hospital, it's about what happens after the hospital. Life. A kid being able to play baseball again, a mom planning a wedding. And so for the first time, I put that all together, and after I did a brief internship in Washington looking at politics, I decided that I could make, hopefully, a better impact in healthcare than I could politics. So the journey led me from Abilene to Waco to San Antonio for Trinity University, where I did my graduate work. Went to Dallas right after graduate school to Texas Health Resources, which was a conglomeration of Presbyterian Health and Harris Methodist. So I started in faith-based, and that's going to be a theme here. Kind of found myself at the University of Texas chasing a job with a young child, a big job, bigger money. It made a lot of sense at the time. But I found myself dealing not with a job, but with a child with some challenges. And we spent time in 5 different children's hospitals across 4 states, and kind of reminded myself of why I got into the business. I was good at the business part of it, but I really wanted to be better at the soul part of it. So I actually found a job in Oklahoma City at Children's Hospital. Best job I've ever had in my life. Sybil, you're going to talk me out of this later because this is going to become the best job I've ever had in my life, right? And then stayed in Oklahoma City. I was in Oklahoma City for 17 and a half years before I moved here. Never thought I'd be in Oklahoma City, never thought I'd be in Baton Rouge. When I made the decision to look around, my kids had graduated from high school. They were gone. We were empty nesters. I told my wife, we're free agents. We can go wherever we want. And I'd reinvented myself enough at Oklahoma City that it was time for something fresh. Literally a year ago, within a week, I got 3 calls. One about a job in Richmond, Virginia, one about a job in Baton Rouge, and one about a job in Austin, Texas. And where did you guys think I was going to want to go? I mean, we were headed to Austin. And so it was the way it worked out with the interviews. I was back to back in Austin, Baton Rouge, Richmond, or Austin, Richmond, Baton Rouge. Austin was incredibly disappointing. It wasn't the town, the city I grew up going to. It wasn't Texas anymore. I didn't feel a sense of community. I didn't connect. I didn't feel like I'd make an impact. I would be lost in the crowd. Richmond was aristocratic. It wasn't welcoming. It was beautiful. And I got to Baton Rouge. And it had all the components that I wanted to have: a very complex medical center, very much a suburban outreach network, a children's hospital, had all the components, but my wife was like, this is last on the list. Until she came back with me for my final interview. And we sat down with the board, and we had a long dinner. She heard me answer questions for 2 hours. They kept the wine away from me. And as she heard the back and forth, the interchange, not very much a discussion, not an interview. We walked out of the interview and we went to our hotel, and in the car on the way back, she said, this is where we're supposed to be. Because for me, it's about being a part of making an impact in a team, in a community that's ready for it. And I'm here to tell you, as a newcomer to Baton Rouge and South Louisiana, Livingston Parish, there's so much that we have going for us that we don't really take credit for. The talent we have in this community from a medical perspective is unbelievable. The doctors that we have at the lake, just across the interstate at Livingston, at our hospital in Livingston, or our campus at Livingston, we'll talk about the hospital part later. I'll put up against anyone I've worked with in my career. So that's kind of the background of me, and we can get into questions about that later. Here to talk a little bit about the lake and healthcare. We are still coming out of the pandemic. The pandemic is the most impactful moment probably of all of our lives, but for the industry of healthcare, incredibly impactful. 3 years ago, at this time, I was probably on the phone with Taiwan, talking about acquiring PPE. Now, I had never done that in my career, but the pandemic forced us all to do things that we had never done before, and to become very uncomfortable being comfortable with it. I think the impact of the pandemic, from our community perspective, our society perspective, and certain healthcare is not over. Whether it's behavioral health or economic, it's a real issue. So we're still trying to figure out what the post-pandemic world looks like for healthcare. The demand curve, what is the demand curve going to do? We're kind of feeling like it's back from in terms of surgical volume, ER volume, back to where it was in 2019. But there's a lot of uncertainty. It was disruptive for sure, and it changed the way people consume healthcare. We'll see if we get back to where we were before, and some of that may be good, some of it may be bad, but it certainly was changing for us. So coming out of the post-pandemic world, hospital economies across the industry and the nation are the most challenged they've ever been in the history of modern medicine. Hospital systems are losing money, draining cash, laying off people, and it's unbelievably stressful for a hospital executive to operate every day. We feel like we're coming out of it a little bit better at the lake. We've been very disciplined and stewardly about how we manage, we say, God's money, because we're a Catholic and a faith-based organization. It is God's money we're managing. We're here to make an impact for the healing ministry of Jesus Christ. I feel like I can say that now. I'm at a church, so it feels more comfortable. But it's a tough time. The rate pressures we have from Medicare or Medicaid or Blue Cross or Cigna or United, they want to pay us less every time we negotiate a contract. It's a fight. They want to pay us less. Ryan talked about authorizations. They want to deny payment. They want to delay payment. We play the game with them. It will take us sometimes upwards of 100 days to get collected a bill that we bill Blue Cross because of the denial game. So think about this in healthcare versus if you're Walmart with inflation. So we're dealing with inflation like everyone else is. If you're Walmart and Diet Coke goes up by, I just have a Diet Coke back in the back so I can use this, it goes up by 20 cents a bottle, you raise your prices by what? 20 cents plus. In healthcare, we don't have that option. We have pre-negotiated contracts. We've agreed upon rates with Blue Cross. We have set upon rates by Medicare, the federal government, or the state. We can't transfer that inflation over to the people that are paying the bills, including the consumer. It's very difficult. What does pass on to the consumer, a significant amount of that goes unpaid because your copay, your coinsurance, you're like, why am I having to pay this? Because my insurance company didn't pay it. So the rate pressures are significant. It's a tough time to be in the business, combining rate pressure with inflation, and then layer upon that staffing challenges. The pandemic had us, we were in a nursing shortage when the pandemic hit. We were using contract agency nurses to kind of fill in the gaps. Todd's daughter can take advantage of this in a couple of years. And we were paying travelers to come in and help us staff ICUs or the ER. We were paying them about, for a contract labor nurse pre-pandemic, about $65 to $75 an hour to the agency, the staff. That rate jumped up during the pandemic all the way to $150 an hour. How many did we have in Livingston 2 years ago in the ER? None. Well, see, she's taking credit for it. We still have, I mean, we had upwards of 20 at the Regional Medical Center 2 years ago. We now have those rates back to where they were pre-pandemic. So, but the labor market and the rate pressure for payment went up with the pandemic. So again, inflation impacted the workforce. We had a shortage before. We still have a shortage, but the rate pressure because of people that are burnt out, that are leaving early, we're paying more for labor than we've ever paid. So it's a tough time, which means we have to make sure we prime the pump. How do we train more, get more people in healthcare, nurses, respiratory, people talk about nurses and doctors a lot. We all get that we need more doctors and nurses, but we don't talk about respiratory therapists or lab techs or imaging, people that will take an x-ray. Those are equally in shortage now, and we have the same rate pressures there. So I'm telling you all this because pay attention when you vote about who's talking about healthcare workforce, who's talking about access to care, who's talking about health outcomes, because they're all tied together, And I think I'm tired of living in states that are in the bottom 5 in healthcare outcomes. Oklahoma to Louisiana, we kind of rally for who's going to be 47th. It's not a good place to be, but the importance of training more people in healthcare is significant for us going forward. And just pay attention to it, because it may not be taxpayer money, it may be philanthropic sources, but it may be repurposing taxpayer dollars. But the problem's not going to go away, it's going to get worse. For us in Louisiana, access to care, even if you're in North Baton Rouge, is tough to get it to a specialist. To get a specialist that will schedule an appointment with you because you have Medicaid. They may already have 5 Medicaid slots filled on their daily schedule. That's all they can take. So you're not going to get care, and you're going to get what? Sicker. And you're going to get what? A higher hospital bill when you get into the hospital finally. So access to care geographically and economically is really important for the state of Louisiana and the country. And then health outcomes, I think we got to plan around these things to be less sick, more healthy as a state. I'm the first person that's ever moved to Louisiana and lost weight, so I should take credit for that. I've discovered fresh fish and undiscovered chicken fried steak. So Our Lady of the Lake, how do we deal with that? We are in the process of a strategic plan around children's health care and adult health care. We have a key partnership with Children's New Orleans. We decided to come together and try to attack children's health care as a united front versus as competitors. There's an African proverb I've used, and John Nickens at Children's New Orleans has stolen from me, which says, if you want to go fast, go alone. If you want to go far, go together. We desire to go far. Our adult health care plan is centered around our cancer program, our cardiac program, 2 centerpieces for this state economically and from a health perspective. We deliver, I believe, the best cardiac care in the state of Louisiana and maybe the Gulf South. No one knows it. We're going to talk about it more because we want more people to stay here and not go to Houston for their care or New Orleans. Cancer, we've had some key partnerships before with Women's and others. We're looking at how we either reform those partnerships or expand those partnerships, again, to keep more people in Louisiana for their cancer care. We have the best surgical and medical specialty oncologists in the state. as good as I've worked with. At OU, we were NCI designated. It means National Cancer Institute, which is where we want to be here in 5 or 10 years. But our doctors are as good or better than the doctors in Oklahoma City. That really gives us a market essentiality. If we don't take care of those programs in cardiac and cancer, and we can't really keep people in Louisiana, we lose out economically and from a family perspective of people leaving the state to get their care or going to New Orleans in some cases. So that market essentiality is key for us. We've been really happy with the LSU partnership, what it's done for research and our training programs, the partnership with the state. We think that aligns with our faith-based partnership to be there for everybody that needs us. We are celebrating now 10 years of that, as well as 10 years in Livingston. So it's really excited for us to be here. Sybil got me here early on, fed me a chicken salad, and I saw the opportunity here in Livingston. This is the biggest parish in Louisiana without a hospital bed or a hospital operating room. I get it. That's where we're headed. To expand the campus, which I think is beautiful. It actually has a lake. We lost a lake at the Regional Medical Center. But I think the future opportunities for us to develop more care at Livingston is real. It's identified in our strategic planning process already, even though it hasn't gone to the board, to expand procedural and surgical capability at Livingston to ultimately be able to have people stay overnight, maybe even deliver a baby at Livingston. I think we're ready to dream big. Again, I know we have great staff and great people there, and I'm excited to be a part of that, hopefully. And then the uniquity of the lake goes back to the fact that we are here to deliver the healing ministry of Jesus Christ. Irrespective of your faith background, that's pretty aspirational. If we can do just a little bit of that to the people that need us, the least among these or the most among these, we've done a great job. We're the only faith-based health system based in Louisiana, and we're the largest in Louisiana, and I don't think we talk about that enough. I learned the story of St. Francis, who were founded upon his mission, about he signed his name by the symbol, the Tau, the letter Tau, which is on Todd's lapel. And I thought, okay, Greek letter Tau, and I studied it. And I found out it actually isn't the Greek letter Tau. It's the Hebrew letter Tau, which is the last letter in the Hebrew alphabet. And St. Francis picked that to represent the least, the last among these. So we're happy to take care of everyone. The people with the most resources, the most influential politicians or business leaders in the state, we want them to be at the lake, but we want the person that also can't go anywhere else. That's a part of what we do. We're happy to do it. We're happy to do it in Baton Rouge and Ascension and certainly Livingston. And I was told I can ask for questions at the end. I have a typical rule where I don't get off the podium or the stage until I get 3 questions because I can't ever be that good. But what can I answer for you guys? Hopefully I was powerful or good, decent, acceptable. Yes?
I was talking to Sybil earlier, and I just had a curious question. So, whenever y'all built the children's hospital in Baton Rouge, how quick did it meet your expectation? Because it's pretty obvious that we had a need in this region.
Well, the Children's Hospital construction, we opened in 2019 in October, and then literally 4 months later the pandemic happened, so it really stunted the growth. I would also say we probably didn't have as crisp of a plan about what we did with the hospital other than build it. So we're putting that plan together now, but we did realize the capacity this spring where we actually had every bed full, and we were setting records in the ER now every month. So it was a need for sure. I think we're now getting a plan together to really make us organized around how do we address that need. Yes.
Hey, I'm interested in innovative technologies or whatever that's coming up in the healthcare industry. Everybody's facing it in every industry. So what does that look like in healthcare? Like we hear that AI is interacting with patients and they actually like the way AI
I think the AI, the internet are incredibly helpful and also incredibly dangerous at the same time, because I think you still have to have a physician captain in the ship in medical decision making. And one of the things we have to deal with in the ER is you come into the ER, you get an initial diagnosis, and we'll have someone in the family Googling it, and they'll leave because they think they know what to do before the doctor gives them a medication. So it's real. We're using it. A lot of it we're using to look at how we appropriately document, to make sure we capture everything. So tying it in with a physician's dictation, the AI is key. So it's a part of what we're going to do. There's some specialties like radiology where AI to read an image will be very efficient and will help us deal with the workforce issues. We're dealing with virtual care, both electronically, not electronically, what we dealt with telemedicine in the pandemic. Now that's become a part of how we receive care. So that's how do we weave that into access for pediatric patients across the state. If you live in rural western Louisiana, how do we make sure you can tie into a specialist at Children's for your diabetes care? How do we do that? Also at the bedside, we have a virtual nursing program at the lake now. We have a nurse in a bunker that has cameras on the rooms to help the nurses that are on the floor. It helps us with nursing ratios and maximize nursing resource to the patients and the family. That's been very helpful. It's increased satisfaction and quality because you have an extra set of eyes. And also the new nurses coming in have spent their childhood on Xbox. So it's kind of normal to have a headset talking to another nurse in a bunker. So a lot of technology at play. We can't do things the way we've always done them with all the technology we have. Question, Rick?
Are you aware that Walker High has a nursing program? And how have you reached out to that and encouraged future nurses?
I have not. Ryan's aware of it. I know our team is aware of it. We have a workforce development group. Tina Schaefer is based at Ascension, so she's really plugged in on this side, really plugged into the high schools and community colleges and universities. So thank you for telling me. Now I'll make sure I emphasize it to the team.
Great.
Yeah, we do work with states.
Yeah. Oh, wonderful.
Yeah, so-
My daughter will go there.
So
and
just
I'm
ask
sure
Sybil
she
all
is-
the next question.
It's awesome. We do have a formal program, so
That's great. Thank you for the opportunity for the students of Livingston.
Yes, sir.
I just have this is not a question, I enjoy your talk on the way, but, Lady Lake's part of the city of Walker, exercise, we have a health initiative in our city. We have to have an exercise room in our new city hall, also for our employees. But, Ms. Sybil is the best person we work with, and, we have enjoyed our partnership there, and as y'all move forward, we're excited about it. And, anything y'all need, you just need to let us know.
Well, thank you. We have changed the organizational structure at the lake a bit. We had a chief operating officer that was over the entire Baton Rouge market. And we've switched that to have someone that's only over the regional medical center, so I can have an executive that looks after Livingston and Ascension. It tended to get lost sometimes in the shuffle. And so Sybil's a part of that new structure for sure. And we all work for her, by the way. You said work for her, and you're right.
That was a slip.
That's probably right.
I echo Sybil. She's on our board. She's been involved ever since she went through the leadership program, all those things, and she's been a great partner for us as well, and tying y'all in to what we're doing here.
Thank you. Well, thanks, guys. I enjoyed it. I hope I get invited back. So.